guys use an endorectal coil in prostate MRI imaging at University of Michigan?
No, we don't. I used it during my fellowship, and I had a lot of experience putting in the endorectal coils. The patients are not a big fan. The fellows who put in the endorectal coils are not a big fan. The nurses are not a big fan. I do think that when you put an endorectal coil in, you can probably improve the diagnostic accuracy of your exam, and you can probably get better images in your best cases. But I also think that when you have a process that we do thousands of these every single year, and we do them at all times of the day, at 3 a.m., at 2 a.m., patients are coming in to get their prostate MRI. And when you have a system like that, any new process you introduce into it or any more complexity you put into the process, like an endorectal coil, introduces variation. Sometimes the endorectal coil ends up too high or too low, or is too overinflated, has too much pressure on the peripheral zone, or induces artifacts or rectal spasm. And those challenges basically limit interpretation of the peripheral zone in a fraction of cases. So although in aggregate you can get some improved accuracy in some cases, I also think that in other cases you can actually make the exam quality worse. On top of which, if you have an endorectal coil process, you have to have people to put it in. At our institution, that would be basically the fellows, residents, and physicians. And since our operation is 24/7, we personally don't think it's feasible to have residents and fellows coming in here, or attendings, frankly, at 3 in the morning to put an endorectal coil in. So long and short, I think it is not being used at most centers now for the reasons I discussed, mostly logistics, and that's our current practice.
This is Dr. Thomas Kelly from Loma Linda University Medical Center. So, Dr. Kelly, what is your opinion of endorectal coil for prostate MR?
Sure. When I started my career, we used a 1.5 Tesla with the endorectal coil, and then we got the 3 Tesla magnet. We used the 3 Tesla without endorectal coil, and I prefer the 3 Tesla much more than I do the 1.5. The 1.5 with the endorectal coil, there's a lot of patient motion. The patients don't like it. It's a huge to-do. While they prefer the 3T, and I find the 3T picture is much better. There's now a 3T with the endorectal coil. We don't have the coil at this time. The patients don't like the coil, and so we generally don't, use the coil.
What is the practice at Loma Linda?
At Loma Linda, everybody that gets ordered a prostate MR gets a 3 Tesla unless their doctor specifically orders a endorectal coil. Then we do that at the 1.5 with the endorectal coil.
So I'm here today with Dr. Fred Couch from the University of Wisconsin to talk prostate imaging. Good morning, Dr. Couch.
Hi, Laurie.
Thanks for joining us. I would like to ask you if you use an endorectal coil in your practice.
Once in a while, we used to use it as the predominant, as most people did, but as we improved over the year, 3T imaging of the prostate, we've evolved with probably, I guess, 90 to 95% of the studies we now do it with 3T imaging. The 1.5 imaging, maybe for patients with certain specific needs, so they'll kind of have a large paunch, so the body coil will be far away from the prostate gland itself. That, however, still is a subject of research to see if it actually does improve the quality. But very few times now that we use the 1.5.
So currently mainly with patients with large body habits?
I think maybe pushing the coils away from the prostate and weakening the signal, even at 3T.
Okay. How about in your post-operative patients?
Post-operative patient, we actually started those with 3T. That was our first foray into 3T here several years ago because they could not get the patients on in time. They asked if we could just do it at 3T at night without having to have a coil placed, and physicians in our practice put it in and not technologists as in some practices. So that was how we got into 3T imaging. And I can't say that I've routinely used it for post-surgical patients either.
Okay.